And back in March this year, Kenya, like many other countries in the world, grappled with how to tackle the novel coronavirus. The approach was a trial and error affair that came with promises to boost capacity in our health facilities and to cushion Kenyans from the economic shocks. On the last national reminder of the year, Victoria Rubadiri takes stock of the government's response to the pandemic over the last several months. Take a look.
On March 15th, 2 days after the first COVID-19 case was confirmed in Kenya, President Uhuru Kenyatta addressed a nervous nation, giving various containment measures, including restrictions on international travel, inter-county movement, quarantine, and closure of schools. Now, 10 days later, the president returned with some interventions to cushion Kenyans. The tax relief measures were one, and in addition, 10 billion shillings to the elderly, orphans and other vulnerable groups. 1 billion shillings from the Universal Health Coverage Kitty would be immediately appropriated strictly towards the recruitment of additional health workers. The president also went as far as taking a voluntary salary reduction alongside senior members of his administration. He and his deputy reportedly took an 80% slash. Now, on April 6th, the president announced the cessation of movement in and out of Nairobi, Kilifi, Kwale, and Mombasa counties. By that time, 158 people had tested positive for COVID-19. 10 days later, on the 16th of April, the president directed the Ministry of Health to create a welfare package to cushion frontline officers. He also directed the county governments to receive a 3-month waiver from the Kenya Medical Supplies Authority, or KEMSA, from the requirements for the purchase of masks and PPEs. Counties would also receive 5 billion shillings to help fight the virus. This disbursement was effected in June of this year. A weekly COVID-19 support stipend for vulnerable families was launched that day too, alongside 8.5 billion shillings to the elderly under the cash transfer program. And that was not all.
500 million shillings, which were in arrears, have also been released to persons with severe disabilities.
In a later speech, he would reveal that every week a total of 250 million shillings would be dispatched to vulnerable families, which was part of the 8.5 billion shilling COVID-19 support stipend. That same month, on the 25th, cases had jumped to 343. The National Hygiene Program was announced and expected to create jobs by employing 26,148 workers and eventually growing to over 100,000 youth.
The inaugural cluster of employment in the program that I have just announced, the National Hygiene Program, will involve residents in 23 informal settlements across 7 of the most affected counties.
To date, the program has employed 283,210 youth countrywide, though it is scheduled to end in December. Small businesses across the country were to be engaged to manufacture basic medical equipment and supplies for domestic use and export. And by May 16th, during the president's next address, 50 COVID-19 deaths were reported. Our borders with Tanzania and Somalia were closed except for movement of cargo. On May 23rd, the president gave his 7th address on the COVID-19 pandemic, unveiling an 8-point economic stimulus program. The plan included a 6.5 billion shilling allocation to the Ministry of Education.
The purpose of this is to hire an additional 10,000 teachers and an additional 1,000 ICT interns to support our digital learning program. The program will also support the improvement of school infrastructure, including the acquisition of an additional 250,000 desks across the country, and these desks will be made by our local artisans across the country.
This month, the Teacher Service Commission said it would recruit 6,674 intern teachers for primary and secondary schools to serve for 12 months. The teacher interns attached to primary schools will be eligible for a monthly stipend of 15,000 shillings, while those in secondary will get 20,000 shillings. On the matter of desks, in September, 1.9 billion shillings was allocated for the purchase of the desks, with an October 19th deadline to deliver them to primary and secondary schools. The deadline was missed, with no school having received the furniture. It also emerged that some of the carpenters awarded tenders to supply the desks and lockers withdrew, citing low prices. As they say, better late than never. The desks were eventually distributed to various schools ahead of the January 4th reopening date. Also, in the president's May 23rd speech, he announced the hiring of an additional 5,000 healthcare workers for a period of 1 year. To this end, the Nairobi Metropolitan Services recruited 225 health workers in June and pledged to hire 1,400 more in October.
We have got doctors. We've got about 1,000 doctors that we hired on short term for a 6 months period. We have got another lot that we hired for a year on contracts of a year and so on and so forth, with different terms of engagement, separate from the doctors who work on permanent basis. And for us, we saw it as an opportunity for us to at least assist some doctors who are out there without jobs and say to ourselves, we need doctors, even if we don't have the money to hire doctors. Can we at least look for something to hire these ones to assist us during this time of COVID? And hopefully, we look for money to see whether we can engage them on permanent basis and therefore on new terms basis.
And to further capacitate public hospitals, the president announced this intervention.
Further, the stimulus program will set aside a further 1.7 billion shillings for the expansion of bed capacity in our public hospitals. And here, I encourage our Ministry of Health to utilize our Juakali sector in this endeavor.
A fortnight later, the president addressed the nation once more. By this time, he revealed that the government disbursed 5 billion shillings to the counties to increase their healthcare capacity. A 300-bed capacity threshold was set for counties to meet. Now, according to reports, by September this year, only 7 counties had attained the 300 isolation bed capacity, raising questions on how the 5 billion shillings allocated for the exercise was utilized. All the same, the president continued to laud his administration's efforts in cushioning Kenyans.
My administration injected 216 billion back into the economy through tax refunds, rebates and waivers. In our second phase, we have further rolled out 53.7 billion under an 8-point stimulus package to reinvigorate our economy.
In his 2 July addresses, the president opened up travel within Kenya and announced the resumption of international travel. It was also the month the first healthcare worker, Dr. Doreen Adisa Lugaliki, succumbed to COVID-19. The national tally by then was well over 17,000 COVID-19 cases. And in his sole August address, the president gave an update on the impact of the tax cuts he announced back in March.
Those tax cuts have put a total of 47.8 billion shillings in the pockets of Kenyans.
However, a multi-billion shilling scandal at KEMSA would overshadow these gains. At the height of the investigations by the Ethics and Anti-Corruption Commission for alleged plunder at KEMSA, President Uhuru Kenyatta directed the Ministry of Health to urgently develop a plan that will ensure transparent tendering.
I also hereby direct that the Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender.
It's done. Today, when you leave here, go to your computer, say you want to procure something from KEMSA, everything is online. It's under IFMIS. Done. Deal.
Later in September, the president directed that some of the economic relief measures in his 8-point economic plan be retained, some going into July 2021.
The National Treasury considers retaining the VAT at 14% until the 1st of July 2021. 2, that the National Treasury considers retaining the income tax rates, pay as you earn, at 25% until the 1st of January 2021.
Now, as the country stared at a new wave of the pandemic and a looming health workers' strike in November, the president took stock of the last 8 months, mentioning that October was by far the country's deadliest. Now, having crossed 94,000 cases, the country prepares to enter a new year, still grappling with the COVID-19 scourge amid half-fulfilled promises. That's your national reminder of the year, lest you forget.